The muscles that our group are in charge of are the psoas major, the iliacus, and the gluteus maximus. We're going to start showing with the psoas major, with our the origin and insertion are shown in red, if you can see here, in here, and here.
And here is the psoas major, which connects here. The origin is the bodies of the transverse process and the lumbar vertebrae, and that would be the 2, 3, 4, and then the insertion goes behind at the lesser trochanter. This is the psoas major. And yes, the nerve innervation is the lumbar plexus, and the action, it flexes the hip and may rotate the hip as well. So we have our client in a side-lying position, allowing the abdominal contents to shift away from the psoas. And we have the hips in hip flex position. We're locating the navel and the anterior superior iliac spine. And midway between those 2 points is where we're going to do a palpation, and we're going to ask them to inhale, and then as they exhale, we start the abdominal palpation, curling the fingers into the abdomen as each exhale and onto the surface of the psoas. And then we're going to ask her to flex the hip slightly so we can feel the psoas contraction.
Can you flex your hip? And there was contraction.
Okay.
Alright, we're going to be doing a stretch for the psoas major. So Taryn, if I can ask you to lunge down on the ground so your knee is touching the floor. Alright, and alright. So then you're just going to thrust your pelvis just ever so slightly backwards. And that's the stretch.
I feel.
Go.
Okay, outlined in blue here is the origin and insertion marks for our next muscle, which is the iliacus.
So this is the iliacus muscle that we've outlined right here. And the origin is the iliac fossa along with the sacrum. It inserts at the lesser trochanter. The action is that it flexes the thigh at the hip joint and rotates it laterally. It also flexes the trunk on hip, as in sitting up from a sitting position. And its nerve innervation is the femoral nerve. That's it. Okay, so now we're going to start with a palpation for the iliacus. The patient is side-lying. Place palpating fingers along fiber direction, just medial to the ASIS, along internal aspect of the iliac crest and the fossa. So there's our ASIS right there. Just putting my fingers right in between. Ask the patient to flex hip against resistance. Note the muscle tissue contraction and palpate from the origin to the insertion. Can you take a deep breath in? Flex against resistance. And there's very much contraction there. We're going to be doing a stretch from the muscle manual. Alright, so this is a stretch for the iliacus. So Taryn, I'm going to ask you to lie on the table. Right. I'm going to ask you to bring your legs just offside. Alright. So with your hands, bring this knee up to your chest and try to straighten that leg down to the ground.
Wow, what a stretch.
Feel the burn.
I feel the burn. Together, those two muscles create the iliopsoas. When do you use your iliopsoas? You use it when you're hiking, when you're climbing, when you're walking up an incline, getting up from a reclined position, the movement of a small sit-up, reaching up against gravity to untie ropes around your ankles that suspend you upside down from a tree limb. Yes, ladies and gentlemen, that can happen. Our next muscle we're working on is the gluteus maximus. Now we have our anterior view of the pelvis, and everybody knows that your butt is not on your front. So, we're going to use the back. This is a posterior view. Okay, Danielle.
And here is the gluteus maximus. The origin is the iliac crest, the sacrum, the coccyx, and the aponeurosis of the sacrospinalis. The insertion is the iliotibial tract of the fascia lata in the lateral part of the linea aspera under the greater trochanter femur. The action is it extends the thigh at hip joint and laterally rotates the thigh. And the innervation is the inferior gluteal nerve.
Okay, so we're going to be palpating the gluteus maximus, which is this region. So I'm going to do it over here so you can see. The origin is up here by the sacrum, so I'm going to place my hand over her sacrum, and the insertion is over here by her greater trochanter. So, asking Taryn to raise her leg to the ceiling, I'm going to apply resistance, and then I'm going to feel the gluteus maximus contract through its origin, and you can relax.
It's this whole big thing right here.
Lie on the table, please. And if you could bring your leg up towards your chest and hold on to it. And that is a stretch of the gluteus maximus.
And those are the 3 muscles that we were in charge of. What were they, girls?
Psoas major,
Gluteus maximus.
and iliacus.